Hello YouTube, welcome back to the Pharmacist. This is the fourth video from the series related to hair loss. In this video we will explore hair transplant surgery, particularly the different types, advantages and considerations. You can also check the other three parts of this series in my channel, I will leave a link down below. So whether you're dealing with hair loss yourself or just curious about this common treatment, you're in the right place. Now caution, this is a medical disclaimer. Video contents are made only for informational and educational purposes. The video content is not intended to substitute for professional medical advice, diagnosis or treatment. Always seek the advice of your physician or other qualified healthcare professionals if you have any questions regarding a medical condition. Okay, let's start. So what exactly is hair transplant surgery? Hair transplant surgery is a medical procedure used to treat hair loss by transplanting hair follicles from one part of the body, typically the back of sides of the scalp, to areas with thinning or no hair. This surgical technique can help individuals with male and female pattern baldness as well as other forms of hair loss. Now I'm going to explain the types of hair transplant surgery briefly. So the first one is follicular unit transplantation, FUT. In FUT, a strip of skin containing hair follicles is surgically removed from the donor area, usually the back of the scalp. The removed strip is then dissected into individual grafts containing 1 to several hair follicles. Each follicular unit can contain 1 to 4 hair follicles. These grafts are carefully implanted into the recipient area where hair loss is occurring in small precise incisions. FUT can yield a high number of grafts in a single session, making it suitable for individuals with extensive hair loss. The procedure leaves a linear scar at the donor site which can be visible if the hair is cut very short. The second type is follicular unit extraction, FUE. FUE is a modern and minimally invasive hair transplant technique used to treat hair loss and baldness. The first step is the donor area selection. Typically, this area is located at the back or sides of the head where the hair is genetically resistant to balding. The second step is extraction of hair follicles. Individual hair follicles are extracted one at a time from the donor area using a micropunch or a specialized FUE device. The extraction process leaves tiny round scars at the donor site. The next step is recipient site preparation. Small incisions or recipient sites are created in the both or thinning areas of the scalp where the hair will be transplanted. The next step is hair follicle implantation. The angle, depth and direction of placement are crucial to achieving a natural appearance. After the procedure, there is a healing and recovery period. Initially, the transplanted hair may fall out, but this is a normal part of the process. New hair growth typically begins within a few months. FUE is generally associated with less post-operative pain and discomfort compared to FUT. And the last type is direct hair implantation, DHI. It is a specialized hair transplant technique that falls under the umbrella of follicular unit extraction, FUE. And how DHI differ from FUE? DHI is designed to provide a more precise and controlled method of hair follicle extraction and implantation. DHI is often considered an advancement in FUE technology. DHI also uses the FUE method for extraction, but it has a unique step where the extracted grafts are immediately implanted using a CHO implanter pen. This eliminates the need to store and handle grafts separately. DHI uses the CHO implanter pen to create recipient sites simultaneously during the implantation process. This can result in more precise and controlled placement of grafts. The above mentioned device allows for more precise control over the angle, depth and direction of graft implantation. This can lead to a more natural and aesthetically pleasing outcome. DHI, like FUE, leaves small dot-like scars at the donor's sites which are similar in appearance, and as it is less invasive than FUT, patients can often return to their regular activities sooner. Ultimately, the choice between the three types of hair transplant procedures should be made after thorough consultation with a qualified and experienced hair transplant specialist who can assess your specific needs, donor hair quality and desired outcome. And the next thing I want to talk about are the key considerations. Firstly, donor area. The donor area is selected because the hair follicles there are typically resistant to the effects of the hormone dihydrotestosterone DHT, which is responsible for male and female pattern baldness. This makes the transplanted hair more likely to grow and remain in place. Secondly, natural looking results. A skilled surgeon will carefully design the hairline and strategically place grafts to achieve natural looking results. The angle, direction and density of the transplanted hair are essential factors in creating a realistic appearance. Number of sessions is the next thing. Hair transplant surgery might be performed in multiple sessions, with each session involving the transplantation of a specific number of grafts. The number of sessions required depends on the extent of hair loss and the desired outcome. Recovery period. After the procedure, there is a recovery period during which the transplanted hair sheds and new hair begins to grow. It can take several months to see significant results. And the last thing is scarring. FUT leaves a linear scar at the donor site, which can typically be concealed by surrounding hair. FUE leaves tiny round scars that are less noticeable and may not require hair to be grown long to hide them. And now, what are the advantages of hair transplant? Firstly, permanent results. Transplanted hair is typically permanent and not susceptible to further hair loss. Next thing is natural appearance. When performed by a skilled surgeon, hair transplant surgery can yield natural looking results. And the last thing I want to talk about are considerations and limitations. Firstly, cost. Hair transplant surgery may occur as expensive to some people, and costs can vary widely based on factors such as the number of grafts needed. Secondly, suitability. Not everyone is suitable candidate for hair transplant surgery. A thorough evaluation by a qualified surgeon is necessary to determine candidacy. Another thing is the progressive hair loss. Hair loss may continue in untreated areas of the scalp, so ongoing hair loss management may be necessary. So, as a conclusion, hair transplant surgery can be an effective and permanent solution for individuals seeking to restore their hair. But remember, it's essential to consult with a board-certified, experienced hair transplant surgeon who can assess your specific needs and provide personalized recommendations. I hope you found this video informative. If so, please like it and subscribe to my channel for more videos like this. Till next time, see you, bye bye.